we founded ScriptsRx to change the pharmacy experience by taking technology and taking what is generally a very antiquated market and bringing technology to that so that we can offer a better service level and do that at a lower cost to decrease the overall cost to the healthcare system. What we're trying to do is to eliminate a lot of the manual processes that exist in traditional pharmacy space. One of those issues is that a lot of medical care is done through a paper process. You're bringing large amounts of volume in at one period of time, so thousands of prescriptions a week are coming in for each manufacturer. The average person who we had doing data entry was entering approximately anywhere from 8 to 12 prescriptions per hour, and we're getting 600 prescriptions per day, and so we had a team of 8 to 10 people that all day were just doing data entry.
There's a lot of data coming into the organization. There's a lot of redundant data entry that was needed because of that. If you have a piece of paper and you need to get that piece of paper into another system without some sort of OCR automation sitting in between those two things, you have to take it and transcribe it into the system of record, which is an arduous process.
If we have 12 prescriptions per hour and 1,000 prescriptions per week, right? You're talking about 2 or 3 heads just to do data entry. We were asking the question, how could we eliminate paper altogether? How could we make it so that we don't have to have any manual intervention at all? Impact happened to be one of the very few solutions that we found that had something that we could take and deploy in a way that was going to change our business meaningfully and allow us to become more efficient.
Right away, it became apparent that there was workflow issues that we needed to sort out. So things where data was moving from point A to point B to C, as well as the volume and all of the handwritten information in there. We recommended Kofax specifically because of the OCR capabilities. We looked at what the OCR capabilities would be, like what would be possible to do, what are the integrations, all those sorts of things. And we bubble that up into a plan. There's 2 things to kind of balance in there. There's the straight through nature of the process, like how well is the data organized and how quickly can we push it through, and then there's also the, when it's not, what is the actual remediation time? And then through the course of execution, we kind of narrow down that plan to get to the end result, the end product. Matt and I kind of came back to the table to look at how that process was running, and then from the balance of those 2 things, we can kind of get it together to say that we've done 6,000 within 90 days. It's been touched by these 4 resources or these 3 resources, and they took only X amount of time to process them.
On average, it was costing us probably 55 cents to $1 per prescription to do the data entry through. With Impact's technology, right, because it's a fixed cost up front, the cost is effectively 0 for us to process a prescription. But it allows us to devote those resources and devote our capital to other innovations in other spaces of our business.
Some definite next steps are to make sure that Matt has the analytics that he needs to fully understand what the throughput is on the process, and then we go back to the table, look at what the analysis is bringing from a data perspective, and then we can adjust even further to try to fine-tune those individual spots.
The ability for us to take a paper process and find a way to fully automate that was something that I think we had dreamed was a possibility, but didn't necessarily know was going to be something that we could achieve. The idea of being able to do that was exciting to us, and the idea of being able to do that over a pretty short time frame of implementation was exciting. The nice thing about working with Impact is that they can deliver results without significant amounts of our time spent, which is important to us because the data entry process is not the only part that we're trying to automate. We're trying to automate a lot of other parts of our pharmacy, and so the ability to get results without requiring a significant amount of our time is a significant driver of why Impact's been a good partner for us.